Now, switching topics just a bit, breast cancer has been conquered in many ways, but certain types remain problematic.
Alex had the chance to chat with a couple of ladies close to the matter.
Well, it's clear that significant advancements have been made in breast cancer research and treatment over the past 30 years. But while many people now think of breast cancer as curable, there's still no cure for something called metastatic breast cancer. In fact, it's estimated that over 150,000 people are living with it today. Here to tell us more are Shirley Mertz, patient and president of the Metastatic Breast Cancer Network, and Dr. Freda Lewis-Hall, chief medical officer and executive vice president of Pfizer. Good morning, ladies. How are you?
Good morning.
So let's start out a little bit broad. So what is metastatic breast cancer and what should people know about it?
So simply put, metastatic breast cancer is when breast cancer spreads beyond the breast to other organs of the body. And this is really important for people to know because about 1 in 3 people who are diagnosed with metastatic breast cancer and treated for it will go on to develop metastatic breast cancer at some point. And this can happen shortly after their initial diagnosis, or it can happen many, many years later.
Well, I'm sure a lot of people find that shocking. I mean, just to think that finally you're over this hump and then all of a sudden now, in sort of a metastasized way, it comes back. Now, what are some misperceptions and some facts that people should know about this?
Well, let me start. Pfizer did a survey of about 2,000 people nationally, and a stunning fact is about 60% of people said they knew little or nothing at all about metastatic breast cancer. So that's kind of a baseline. About half of the people said that they felt perhaps people with metastatic breast cancer had not done enough, not been diagnosed early enough, not been aggressive enough in their treatment. So if you would, it was kind of their fault. And we think this is really important to educate about because it is absolutely not their fault. And we don't want women with metastatic breast cancer to blame themselves, and we should know that we shouldn't be blaming them.
Well, I think that's a very important point to bring up. I mean, it's something that's out of their control. And now, besides, of course, early detection, and everyone's encouraged to go out and check, constantly, what are some treatment options for people with metastatic breast cancer?
Well, when we talk about metastatic breast cancer, we're not talking about one disease. We're talking about different types or subtypes of the disease, which is the same of early stage. So one of the things that's important is for a newly diagnosed patient to know what kind of breast cancer, metastatic disease they have, and then to understand from their treating physician what treatments might work for their subtype. This is the best approach to understanding and empowering the patient to get the very best treatment and with hope for the best outcomes.
I agree. And what, from a moral standpoint or from any other standpoint, what can be done to better support people living with this disease?
So again, it's really important to acknowledge that to provide support, this disease does not have a cure. And this means that women who are in treatment for metastatic breast cancer are always in treatment for that. So as Shirley said, knowing your subtype so that you really understand your disease, understanding the prognosis or outlook for you in the disease, being aware of new treatments, so staying informed of new options perhaps, either through your physician or through a clinical trial. These are all very empowering for the person with metastatic breast cancer and also for the extensive support network that's needed to ensure that life is as full as it can be.
Well, of course, it's all about staying positive and, your support system with your family and your friends. Now, where can people get more information about this to get educated?
Yep, we also think that being educated is really important. So a great place to start is gethealthystayhealthy.com. There's information on metastatic breast cancer there, as well as some information on the survey that we talked about a little bit earlier, and links to really important, informative other resources like...
The Metastatic Breast Cancer Network has a website, mbcn.org. This is for patients and their caregivers, and we welcome you to seek out that site for treatment information, stories about those living with the disease, and where you can find support groups.
Well, Shirley Mertz and Dr. Freda Lewis-Hall, thank you ladies so much for joining us today.
Thanks to
you.
Thank you. And stay where you are. We'll be right back.